Hi, this is Dr. Mike, and the video for today is Fibromyalgia new blood test. In this video, I'll be talking a little bit more about some of the blood tests and other tests that are done for fibromyalgia sufferers in the process of diagnosing and figuring out what's going on. And then I'll also go through some of the newer tests and newer research that could have some really promising outcomes for fibromyalgia, and these are far more recent. So before we get into that, please note this presentation is not intended to provide individual patient advice, but rather it's a way of providing education about fibromyalgia. And if you think you have a condition that is causing you chronic pain, please talk to your doctor and get a proper diagnosis and treatment plan. So, is there a test for fibromyalgia? Currently, the diagnosis of fibromyalgia is by exclusion, which basically means when they've ruled out that you don't have any other conditions causing your symptoms, then what you're left with is fibromyalgia. And there is currently no empirically proven diagnostic test, meaning that there isn't one well-researched, well-defined, and overwhelmingly well accepted test for this medically. And as a result, diagnosis can be a lengthy process of ruling out other diseases and medical conditions first before you eventually get to fibromyalgia diagnosis. And unfortunately, this process could even take years for some people. So it can be a really difficult situation. So currently they make the diagnosis of fibromyalgia using diagnostic criteria, meaning they have a certain group of symptoms and such as, tender points throughout your body that get tested. I have some more information about that in some of my other videos. And then some of the other symptoms like fatigue and waking unrefreshed, or cognitive symptoms. So they generally bundle all these symptoms together, they rate them, and then based on that, you get a kind of a score or an overwhelming number of symptoms that then lead to the diagnosis of fibromyalgia. When it comes to laboratory testing, blood testing, etc., they either do these tests to rule out other diseases which may be causing the symptoms, or to diagnose other diseases that occur along with fibromyalgia. So there are some conditions like rheumatoid arthritis or autoimmune conditions or infections, a whole lot of other different diseases that they need to test for. And those could be labeled causative disorders, meaning that they are causing your symptoms. And then they, like I said, lab tests, blood tests, x-rays or MRI or other special tests could be performed. Sometimes they'll refer to it as primary versus secondary fibromyalgia, meaning primary fibromyalgia means that it is the main condition that you've got going on. You don't have anything else going on. Secondary fibromyalgia could be happening as a result of another condition or problem going on. It kind of depends on which therapist or doctor you're consulting, because the opinions about that are widespread. Then the FMA test is basically a newer test that they've been researching, which is quite promising. They are still in the research phase of it, and the test collects plasma and peripheral blood in a small sample, and they give it what they call a mitogenic challenge, which is just they expose the blood sample to certain substances that create a reaction from your own immune cells, blood cells, and then they measure what this reaction is. And the reaction is typically a release of cytokines. These are little chemical messengers your immune systems use to trigger an immune response. And what they're finding is that how these immune chemicals or compounds, the concentrations that they're in will determine or reflect how your immune system is reacting to this challenge. So they did a study in 2012 of around 200 people, and they found that the cytokine responses from patients with fibromyalgia were significantly lower than those of healthy individuals. And that implies that basically the way your immune system is reacting is impaired. And that these lower levels of cytokines have a kind of a pattern or a profile pattern that could be unique to fibromyalgia, and then could ultimately be used as a test to diagnose fibromyalgia, because they see this pattern, and now they kind of need to figure out, could this pattern kind of distinguish fibromyalgia from any other kinds of conditions? And this pattern pretty much has higher pro-inflammatory cytokines. Certain kinds are higher, and the anti-inflammatory cytokines tend to be lower. So basically that is some of the more promising information about this test. They did a follow-up study, and they found that this test could distinguish fibromyalgia from lupus and rheumatoid arthritis. Obviously, there are also other tests that they do for lupus and rheumatoid arthritis, blood tests. But yeah, this, like I say, this pattern of this blood test, this profile, is still an area of ongoing research. But practically, it is being used in certain places, in certain countries, by certain companies where they're doing this test as an indicator of fibromyalgia. As I said, it's early stages of research, and what that means is that if it's not generally accepted, then it can be, difficult to work with certain, providers, therapists, doctors, because they, are not necessarily working with the latest research, or even using it because it's not generally accepted. And the same goes for a lot of medical insurance, and thus it's not really well used in general practice, but it is something promising for the future. So hope you enjoyed the video. Please check out my next video in the series. It's called Fibromyalgia. Is fibromyalgia an autoimmune disease? And then if you're interested, there is a 10-part fibromyalgia mini course. The link should be in the description or in the comment section. Feel free to comment, subscribe, and hit the like button. And I hope to see you at some of my other videos.